I
Okay.
don't have the option. I don't know why.
Don't worry.
Sorry.
No problem. It's done. Don't worry. It's good. So thank you, Henry. So yeah, I see that nobody has shared an opinion. So maybe we can keep it every 2 weeks, and if we manage to find live translation, we will do that so that we can have a joint Spanish, English, French session and gain more from the exchange as long as we can get the translation going. Um, and yeah, again, the contact list, we really welcome your information and updates, including, emails, phone numbers, the key language, so that we can tailor the emails and the invitations to avoid too many messages from our side. Um, just to note that we do have a number of regional colleagues who may have been getting this invitation as well in both English and Spanish. So you can indicate on the comments on the contact list if you prefer to be in one of them only, so that you reduce email traffic from our side. Um, Yeah, I don't see anyone sharing opinions in the chat box, so I will move on to the next point. I hope you can all hear me.
Yes, we can hear you, and sorry for being late. Hi, Alban speaking.
Welcome,
Hello,
Alban.
everyone. I don't know if I didn't see the list of everyone. Just to I think we all know each other. I mean, just Alban, I'm the regional WASH specialist, working together with Sunny in Panama for UNICEF. Thank you.
Good afternoon. Sorry, I'm also late. This is Shiming Clozel. I'm joining and representing CARPA, Caribbean Public Health Agency.
Fantastic. Welcome. I conscious that we have about 30 participants, and if we can keep to the time, we might be able at the end to have a brief introduction from on everyone. I know it's a bit the other way around, but just to respect the time, maybe we can have introductions at the end if there is time. Um, yeah, so moving to the second agenda item, since in the first there weren't any comments or questions. We have the technical response for washing COVID has, a number of different areas. And in the presentation, we try to put links to the key resources in those sections. So the key message here is that, WASH is working across as usual across different areas. So from, safe management of water supplies, wastewater, fecal waste, to washing healthcare facilities, washing schools, washing at home and community and public spaces. There are some notes on secondary impact in WASH due to the COVID outbreak. There is, hygiene promotion, programming, resources available as well, focus on COVID, as well as the UNICEF, WHO, WASH for COVID response technical guidance. So just to sort of outline the different areas and put a link to the resources. And the original website that we shared early on had, has all of these resources available. Um, Besides what's being produced at a technical level, there's also some operational considerations coming out. There's been a sphere standards for COVID in camp settings. The Cash Learning Partnership has put out a guidance for the COVID response, and I know many agencies are really considering cash-based interventions and looking at the market, given the challenges faced across the countries on hygiene and hygiene products market. There has also been a number of agencies coming out with humanitarian cash transfer guidance. UNICEF, for example, came with one, but other NGOs and agencies have also released them. Um, and there's also been a World Bank real-time evaluation on social protection live report that was released, and that's also available on our website. So just wanted to highlight a bit what's available so far. And now I will hand it over to Henry, who will talk a little bit about the key lines of intervention.
Okay, thanks, Sunny. Well, as you know, who prepared at the beginning of the year the strategic preparedness and response plans to COVID. I don't know if all of you have been seen there, but it's important to mention that because we are working on those lines and working in the group, in this regional WASH group. Maybe most of the actions relating with WASH group are concentrated in both pillars. Number two, for example, all the actions relating to risk communication and community participation, with all the actions regarding to hygiene promotion, and pillar number 6, prevention and control infections, where some areas of work like WASH in healthcare facilities, WASH in schools, WASH in homes and communities are the main interventions. But when we read each pillar, it's important to know that we have a space to strengthen action and capacities in all of them. Now you can find the who website, the COVID strategy update in 14 April. On the next two slides, you can see the key lines of intervention, but something that I would like to highlight is that we must know what we have to do immediately and in the middle and in the long time. Maybe one of the best strategies in some cases is to strengthen the programs in course and include actions related to COVID-19, for example, safety water plants and COVID, or healthcare facilities and COVID-19. This is just a list to check the key lines of intervention to organize our work. Maybe all of you have been working on them. We have to understand that this is not a classic response to an emergency, but we can take some guidelines of classic emergencies to have a more organized response with specific lines of intervention and have a response with an intersectoral approach. We have to understand not only the health services, but also the other systems of the other sectors to know what is important to do. For example, when we see the pillar number 4 of the strategy, WHO strategy plan, access points, we must think about those vulnerable places where people don't have water supply, and it's important to promote hand washing strategies and keeping in mind those places related with migration and health. Next, please. Something that I would like to highlight is the coordination mechanisms in order to facilitate the different WASH interventions to be timely and efficient in the response. It's important to know what we are doing, what the others are doing to have the best coordination. This is an opportunity with all of you in order to know that and to take some information to strengthen the activities that we are working on the regional group. From PAHO and the other actors, partners, we are working in fact sheets to socialize technical information to the countries to facilitate their activities at the local level. For the case of PAHO, when we have ready those documents, we are going to share with you through the regional WASH-LAC group. Thank you. Over to you, Sunny.
Thanks, Henry. I think one key thing is that we've been hearing from the different sector platforms, WASH coordination platforms, about the COVID plans. So I think a lot of colleagues are either preparing or already have done their plans. And next week for the Spanish call, we will be having one of the countries, Ecuador, presenting their plan, their COVID plan. So if colleagues are interested and do speak Spanish, they're welcome to join that. We'll be sending the invitation this afternoon. There will be also presentations from the Colombian government on the measures they're taking on public policies, and a presentation from the WOP WASH-LAC group, which is the operators Latin American group. So yeah, bringing in sort of service providers to the table. So let me move to the third and very interesting point, which is the UNICEF CWE mapping of WASH public policies. Before we go there, if you have any questions or comments regarding what we commented so far, the resources, the operational resources available, please feel free to say now or to type it in the chat box. We see oh, go ahead. Was there someone? Maybe I heard something. I just want to welcome the colleagues from COP and highlight that there will be a session, I think a market and cash-based session in English, Spanish, and French. So we will share that link. If we get the link, it would be great. Yeah, we also see colleagues asking for the slides. We will be sharing that and we'll be putting on the our website. Yeah, welcome Valerie from Operators Without Borders. Very good to have you. Danielle, do you want to comment? Do you want to come in and mention about the
Sure.
group?
Thank you, Sunny. Let me introduce myself. My name is Daniel Oporto. I'm the regional director at Water for People. Last week during the Spanish session, we had an interesting discussion on what would be the COVID response in rural and vulnerable areas. We think that most of the discussions right now and most of the communication material is, of course, designed to attend responses for urban areas, as they are the most crowded areas and the more contagion vulnerable right now. At the same time, we think that rural areas are also vulnerable for many reasons, and they will need a different type of response in the future. One of the main things and concerns and requests that we are having is how we are keeping and supporting water systems in rural areas so they keep chlorinated water systems and things like that. So from that discussion, we agreed to have, it's a voluntary process. If you want to join, we are creating a separate group, a discussion group on this matter. I just left my email. If you want to join this discussion, we would like to have a separate, let's say, webinar or discussion with other people in the region or globally, so we can feed this discussion as well. Thank you, Sunny.
Great, thank you. I think it's it's a working group under the WASH-LAC, and I think it's great that Danielle is bringing that on board. I will now invite Virginia from CWE to present. If there are no more comments, let me check. Yeah. Virginia, are you able to share your presentation? I will stop sharing mine.
Virginia, I just made you like presenter, so you should be able to upload your presentation.
She mentioned her internet is not very good right now, so we can add maybe Isabel. Let me make Isabel a presenter right now. Isabel,
Yes,
I just
hi.
made you a presenter. Yeah, go ahead.
Yeah, can you hear me?
Yes, we can hear you.
Perfect. So just a second then. Can you see my screen?
It's uploading right now.
Yeah.
I don't know if Virginia, I don't know if she's able to speak.
It's okay.
Yeah, apparently it's not. Yeah.
Yes, I guess I can take up while she connects. All right, so basically, this presentation, as Sunny mentioned, was done last week. And this was an effort by UNICEF and SIWI to create this joint technical note on water, sanitation, and hygiene sector and its response to the COVID-19. And this one is mainly focused on the initiatives in Latin America and the Caribbean. So where does the idea come from? Alban had shared with us the initiative from UNICEF LACRA that was done by the Protection and Social Protection Group in response to the COVID-19. And this idea of came as complementing the response to the COVID-19 from the WASH perspective. So the objective was identifying specific initiatives of the WASH sector in the face of the pandemic. And with this, we would map the measures that have been implemented in some countries in the region. So how we did this was basically we started off by doing online research, mainly focusing on official websites of corresponding governments. So for example, we looked at websites of the Ministry of Health, or we looked at websites of the coordinating agency that has the responsibility of implementing actions with respect to COVID-19. This different authorities could have been at the national or provincial levels. We also looked at service provider websites, for example, AirSubs in Honduras, or Conagua in Mexico, and we looked also at their national and international partners, such as, for example, the International Development Bank, just to see what were the initiatives that they were looking forward to do. And the last online search was based on the news. We looked at the news published in mass media to know what was the most updated information on the initiatives for every country. And we also looked at mentions in Twitter focused on specific official accounts, for example, the mayor of a specific city, or again, the Ministry of Health and other social networks. We then proceed to do interviews with UNICEF staff, the contacts that we have in the different countries, and they gave us information about the current situation and the status of the confinement, of the different activities that have been implementing in regards to water and sanitation, and as well as the different gaps that they have seen so far. And they also gave us some idea of who are the actors in the sector that are being more active at the moment. We also had contacts with regulating agencies and other local stakeholders that gave us some information on, for example, what are the decrees, how are the decrees that the government has accepted being put in place, and what are their responsibilities in regards to this. And lastly, we came with all this information, all these different initiatives, and we did a compilation of these in a matrix. Where I will show you the structure that we followed. And basically this matrix is not static, as Sonny mentioned. This is like a live matrix that we will keep updating every week or every 2 weeks, where we basically aim to see the different developments that are happening in those activities. And we want to see when these different initiatives are taking place and where they are focused on, and which different aspects of water, sanitation, and hygiene are they focused. So with respect to this structure, we thought that it will be interesting to look at this from 2 main blocks. One of them was the user's perspective, so basically guaranteeing the continued access to water, sanitation, and hygiene services for users. This block has two specific pillars. The first one is to preserve the health and well-being of all people, including the most vulnerable, by meeting their basic water, sanitation, and hygiene needs. The second pillar is to intensify awareness-raising campaigns for infection prevention and control, and the efficient use of water in the home and the public spaces. The second big block is focused on utilities. So what we want to do is to guarantee the provision and proper operation of water, sanitation, and hygiene services, while ensuring the financial sustainability of these utilities. So the third pillar is to ensure the continuity and safety of water and sanitation services on one side, but also to provide technical and financial support to these utilities so they can keep providing the services to all the population. So as you can see in the table number 1, we have identified what will be the key activities per pillar or area that should take place in order to combat the COVID-19 pandemic. So as you can see, the first column is the activity that goes under each area. Then we have also identified which actors should be involved in implementing these activities and what should be the time frame in which this should happen. So just to give you a couple of examples, if we see the activity number 3, that is to immediately reconnect free of charge all households disconnected for non-payment that do not currently receive the water services. So the actors involved in this will be directly the utility, and what the time frame would be is immediate. Others that we have looked at, for example, the establishing, maintaining, and or extending the financial instruments needed to facilitate service payments for vulnerable households, as, for example, implementing some form of subsidy system, freezing bill collection, writing off debts. This kind of incentives should be done by the government and the utility. And the time frame for this particular activity would be immediate or also medium term. So this is just an example. We have defined about 43 different activities that are categorized in the 4 different areas or pillars. And Virginia, if you can tell me if you have, if you're able to share with us if the microphone is working for you. Maybe not. All right, I can continue. All right, so basically,
just hey, let me try. Okay. Let's see. Can you hear me now?
Yes, Virginia, we can hear. And if you are talking now, we cannot hear you anymore, Virginia.
I don't know if Virginia would like me to keep going. Maybe I can do that.
Please go ahead. Yeah, please go ahead.
All right.
Isabel.
Hi.
Okay. Virginia? All right. So, like I was mentioning, we are also looking at.
I'm sorry. Can you hear me?
Yes.
Okay.
Hello?
Virginia, I think we've got an issue with you. It's on and off, so I would really suggest that Isabel continues. Thank you.
All right. Sorry about that. Maybe there's connection problems. So basically, there's the second table that actually summarizes the activities, the initiatives that every country has done with respect to the activities that we have identified. So as you can see in the table, again, we see the pillar number 1 with different activities that I mentioned before, but in this second table we can see the different countries in the different columns. We have chosen to show the color blue, or we have chosen the color blue to represent the governmental initiative or national level. And if we have found that there is initiatives at either subnational level or the non-governmental initiative, we have chose to show this with the yellow color. So as you can see, these are the activities. And what we have seen, for example, at the moment, is that the activity I mentioned before, such as establishing, maintaining, and extending the financial instruments to facilitate service payments, has been done by most countries. And, and we can see the same for the block number 2. That has to do with intensifying awareness campaigns for hand washing, soap, and water, and efficient water use in the home. We have encouraging the immediate restoration or new construction of hand washing points in priorities or hotspots, including schools, health facilities, markets, prisons, stations, and other public places, respecting social distancing. As you can see, there are a few countries that are working on this specific activity, such as Mexico, Venezuela, Honduras, Ecuador. And the strategies to promote hand washing with soap and water to the entire population and different age groups, focusing on the most vulnerable groups, making content available in the different languages used in the countries, and using nudging techniques to encourage good practices. And we have seen this in multiple countries such as Argentina, Brazil, Paraguay, Honduras, and such. With respect to the third pillar of guaranteeing the continuity and safety of water and sanitation services, we can see one example here of ensuring proper operation of drinking water systems at all stages. So collection, production, treatment, and distribution to the final consumer. Planning preventive maintenance tasks at all critical points of the system, whether it be at the intake, in the pipeline, in the treatment plant, and in the distribution network. Monitoring residual chlorine at specific points. So here we can see, for example, that Panama, Paraguay, Ecuador, Honduras, Costa Rica, El Salvador, and Mexico have some initiatives at national level in regards to this. Unfortunately, Virginia had specific examples that we might be able to share later on. But this is just to show you the activities that we have identified. Here also in the pillar number 4, which we want to provide technical and financial support to utilities. One of the activities is to establish a multi-actor emergency coordination mechanisms, which is to include international and multilateral organization and other actors. As you can see, most of the countries have had some already coordinating mechanism in this regard, whether it be at national or subnational levels. So what we have concluded from this exercise so far is that there is definitely more interest or more initiatives in specific areas, such as direct cash transfers, which are the most commonly used measure. These, in general, we have seen that are more related to food security than actual water consumption. And yet it's not clear how these will be implemented. So then again, this is something that we have to continue monitor throughout time. Also, we have seen that there is a reconnection and forbidding the disconnection of services. additional supply for rural areas and vulnerable groups. So basically water trucks that are being sent to rural areas that are lacking water at this moment. But we have also identified that there is far less presence of measures in regards to sanitation, specifically to shared spaces, for example, public bathrooms. We have seen lots of measures with respect to behavioral change, such as hand washing campaigns and such, but very few newly built facilities for hand washing and others. With respect to service providers, we have seen that some measures, there are some measures with respect to financial support along the lines of private sector coping strategies and contingency plans. But there is very little that has been done so far with respect to technical support to service providers. There is a special focus on rural areas, but this is more challenging. There's a more challenging financial situation that we foreseen for this with respect to liquidity and solvency. And there's also, for some countries, a challenging context in which there are some droughts at the moment. So this increases the need for water in certain areas, and there is also a crisis happening at this moment with respect to dengue fever, which also creates more needs for spaces in hospitals and other things like that. And this would also need to think something about related to water storage if this is a problem in some areas. And lastly, there's little indication on how these measures will be implemented and on the medium and long-term recovery phase thus far. And that is all. Thank you so much.
Thanks a lot, Isabel and Virginia. We can now open the floor for questions and comments and a discussion. So if colleagues would like to join in and ask questions. I see there is already some exchange on the chat box.
Yeah, so may I just make a very quick introduction of SIWI and the collaboration with us?
Yes, sure, go ahead.
So basically, I mean, SIWI is the International Water Institute of Stockholm, and since mid last year, we've signed an agreement with SIWI and UNICEF at regional level to support the governance of the WASH sector in 11 countries. The only country that is from the Caribbean that is, I mean, let's say the only two countries in the Caribbean area are Suriname and Haiti, who are part of this agreement. The other 9 countries are Spanish-speaking countries. So, so basically, it's a technical assistance provided to the sector. The national WASH sector through UNICEF country offices, and most of the time we start with an analysis of bottlenecks at sector level to understand what are the components that are really like impeding the sector to grow in terms of financing, policies, coordination, capacity building, monitoring, etc., etc. So it's a very rigorous process that involves all actors, including the private sector, including the end users, and also the academic sector as well, on top of the regulators and policy bodies. And then from this, I mean, there is basically an action plan that is being developed by at country level to remove these bottlenecks. And then we can also provide technical assistance on regulation, on tarification, and so on, everything related to governance of the WASH sector. So it can hardly be expanded, this kind of partnership, to other countries right now. I mean, it could be because we're also discussing with the IDB, so there might be possibilities. But I think what we really want to convey as a message here is that we recognize that from the regional WASH-LAC group, we have not been very present with the Caribbean, but it's something that we want to change, and not only the Caribbean countries where UNICEF is implemented, but any Caribbean country where a potential support could be provided to the WASH sector. So it's we are quite glad that you are here on the call, and basically we are trying to build up this new relationship with the Caribbean. Thank you.
Thank you, Alban. Any reactions to this presentation? Any questions to CIWI and UNICEF colleagues? It's a very quiet group. Henry, do
Hi,
you?
this is Shemaine from
No,
Comfort.
no, we are not quiet.
Okay,
I think
good.
for Suriname, for example, Alban covered what I had to say by saying that we had a wash bath exercise here, and it was very, very helpful. And in COVID-19, when we had a meeting with the Minister of Natural Resources, he came back to the key bottleneck, and so the government, for example, based on the wash bath exercise that we did, they decided, to avoid some taxation related to wash during this period. And so in his speech, he mentioned the wash bath exercise that he did with UNICEF, and so it was very, very interesting for us.
Okay, this is Shemaine from Comfort.
Welcome.
Very interesting presentation. I'm particularly happy that there was a reference to the fact that some of the countries in the region right now, particularly among the islands, are going through an extended dry period, and in some cases, some of the governments have declared droughts. I was just wondering whether you have any sort of messaging resources that speaks directly to that we can support, that we can extend to our member states, because we know the importance of good quality water to WASH efforts. And if we're facing these restrictions right now, we do not want to see that compromise all the other efforts that are taking place right now. So any resources that could be utilized, that could be shared, any lessons that could be applied would be very, very useful at this time. Oh, I also wanted to mention that I'm very happy to hear about CIWI, because in our work with water safety planning, we have recognized the importance of the gathering together of different actors, both public and private, in managing water. And one of the aspects that's always been lacking has been this governance aspect. We tend to do a lot of work at the technical level, so I think I see a lot of potential for partnerships in the future with CIWI. Thank you.
Thank you so much, Sherman. I guess Virginia can respond.
Yes, can you hear me?
Yes, go ahead.
Hi. Sorry. Again, can you please repeat the question? I was having some problems with the audio.
Okay, if you're referring to my question, I was asking about any resources that speak directly to supporting WASH efforts with a diminished access to water, because several of the Caribbean countries are right now going through a drought period.
Yeah, I think that there are two things. I mean, one is I think we'll definitely try to find to help you with resources and
yes,
and good practices about the
can you hear me now again?
Places. But there was, yeah, Virginia, can you hear us? But
can you hear me?
Yes, we can hear you, but apparently you cannot hear us back.
Yes, thank you. I was. I'm not sure if you can hear me, but I'll try. I will speak as if you can hear me. The point of raising the drought and yes. Okay, perfect. The point of raising the drought and the dengue situation is to put a bit of a context on the COVID. It's not that we address drought and potential other diseases like dengue as such. We, of course, are focused on the response for COVID, but we wanted to have some pathways open for the specificities of Latin American countries. We know that the response that the countries are taking must be put into certain perspective. And that is why we pointed out these two emerging issues on which we have to add on the COVID response. But there's not a focus on the drought. We will be very happy to continue researching with you the specific cases. Just for a general comment on what Isabel presented, as she said, this is a living document. Same for the Caribbean countries of what Alban was commenting on. The point is to be together and to have a joint logic to gather the policy measures that the countries are giving. That has a twofold purpose. One is a repertoire, so we can learn from each other, we can know what's going on in other countries, and so on and so forth. And the second is as a list of recommendations that we can use as actions to build an action plan on how to respond. But in any case, we understand this is an emergency situation, and we respond to that. But we have to also think of a second stage of the response, which is the recovery. And we tried to put some seeds of that perspective within the activities. Once you have the time to have a look at these activities under these 4 axes, you'll see, for example, that one of them is financial sustainability of the providers. And this is not something that we are going to focus now, but we wanted to put it in the picture because we are concerned about what is going to be the recovery phase. So there are some countries like Bolivia, for example, that are starting now a study on tariffs and on the financial sustainability of the service providers. We will do this also in collaboration with the regional office, in principle also in Ecuador and in Haiti as results of the WASH-LAC, this diagnostic exercise we've run last year. So it's a bit of having this repertoire to have a look at what is going on, and start thinking on the recovery phase and putting everything into perspective. But it's basically learning from each other. So again, the Caribbean countries, as Alban was saying, I'll be very happy to add them into the matrix. In fact, I've already added Cuba because somebody asked me from the last week's seminar to add it, and I sent the matrix with Cuba to them. So we are expecting information from them, and I'll be happy to do the same for the countries that will demand it, and you will be invited to provide with information, and then we can see from what we have what is worth exploring further, because we'll see some measures. One of the conclusions is also that there's clarity on the measures taken, but there's no clarity on how they will be implemented. This is very clear for example, the direct cash transfers. Most of the Latin American countries have started to say we'll help the most vulnerable with cash transfers, but when they come to the point of implementing them, in Argentina, for example, you have to register, prove your tax situation, and so forth and so forth. So I mean, the government still has to approve your application. In Brazil, they say, okay, we will support the service, the informal workers, but then they don't have a register on that. So they have to now start seeing who's going to be eligible for the help, for the support. In Bolivia, they built on a current system of schooling, support for families with kids at school. So it depends, and everything you will find in the matrix. I just share the link, but if it doesn't work, I'm not sure. We'll of course share the Excel, and in the Excel you will have the measure, like the activity that we found. I mean, as Isabel explained, like the basic activity. Then you have another column where we explain how this specific activity is being implemented in the specific country, and we have a link to the resource. So you have a tab. Probably, Isabel, if we can show at least one minute the Excel as such. So you will see that there is this table that you saw now with the crosses. That's the summary of all the work. But you have one tab per country in the long version of the document, and in that tab per country you have all the list of 40 plus activities, and in one column you have what specifically has been decided by the Ministry of Health or by the Presidency or the Ministry of Infrastructure, or who decided what specifically for that country. And on the following column you have the link to that specific information. Whether it's the public official publication of the decree, of the law, of the regulation, etc., whether it's a piece of information published or broadcast in the mass media. So that depends on the case, on the sources that Isabel has explained, or that we used to map all these activities. So I hope it's yeah. Then you see there is the summary. That's it's Spanish version, but we have it already. The summary is already in English. The country version is not. But you will see in Argentina, for example, as Isabel is showing, the list of activities, and it's in column A. Can we go to a country that at your yeah, for example, the same list of activities that you saw on the summary table, it's in column A. In column B, you have what a specific measure has been taken along the lines of the standard activity of column A. And on column C, you have the links to, as I said, where this piece of legislation is being published, or whether it's mass media news. So you can follow, and that's what we will also like to have it live. I mean, in the countries, you'll see there are countries that have more information. Colombia is being the leader practically of this response. Really, they have a very comprehensive program on response, comprehensive of lots of measures, such as not only direct cash transfers, but also specifically support for service providers, plus the elimination of trade barriers for importing inputs or chemicals needed to treat the water, which is 5% of the overall cost of water treatment. So lots of questions. Chile, for example, has a huge response, but not directly related to water, but more in terms of recovery of the economic crisis that is foreseen after this pandemic. So they are investing 5% of the GDP only for specifically the response of COVID pandemic. So it depends a lot. So we have, again, some countries have more information available, others have less information. The ones that IT, for example, that Alban was mentioning, we started tracing information for IT, but there was not really much. So we took it out from the summary table, but we will be very, very happy to include it again, of course. And then this, which is Venezuela, David Simon has completed, but we have this table here is not like this is IT, yes, of course. So it depends, and you're very welcome to complete, and we will, as Isabel said, update them on a regular basis. So we will add more information, keeping the columns as they are now, but we are adding new information. And one point that I would like to clarify that Isabel was mentioning on the conclusions before giving the floor for more questions and answers, is that when we say the focus on rural, is that it's lacking the focus on rural in general terms. Rural service providers are more vulnerable for the reasons that you all know. They have less capacity to cope in terms of their liquidity, their solvency, their community structures in general. So the fact that users will no longer pay for the water they receive will have an impact that it will be very, very difficult to mitigate. So the concerns on the rural areas, that's also Daniel Oporto was mentioning, and was inviting for a specific group on that, are very, very high for what it may happen, especially in terms of the sustainability of service provision. So that's basically, I stop it here. I can read some questions, or I can receive more questions if you want.
Thank you very much, Virginia. Just to know that I think I see that there is exchange bilaterally to ensure that the other countries and territories of the region are included. So that will be great, so that we can have that sort of monitoring and capturing what's happening in the Caribbean and other countries that are not included yet. Let me give the mic to Cesarina, who wanted to share some experiences from Peru and Paraguay. Cesarina, are you there?
Yes, thank you, Sunny. Hello, everyone. Yes, thank you very much for the very, very important and interesting summary that Virginia has presented. Yes, in the case of Peru, I think one of the measures, most important measures that are complementing the WASH measurements, it's the cash transference. So these cash transfers are virtual for the most vulnerable populations.
Is somebody continuing with the session?
Sorry?
Apologies, everyone. Could you please mute your mic so Cesarina can speak? Because I think we're getting the echo from your mics. Thank you. Cesarina, go ahead. Sorry.
Yeah. So I was mentioning about the cash transfers in Peru. These measurements are addressed to the most vulnerable populations. And so there are many options for virtual. And of course, there is a great part of informality in Peru. And this is the most critical, but the systems of information that are shared but different ministers are trying to be gathered and improve in order to identify where these informal sectors are present. There is a Peruvian economy that has a great support on fiscal tools, but of course I think there are good advances in terms of this. What is critical is to reach the rural area, as it was mentioned, but the Peruvian government are trying to promote mostly the best practices, but of course it is not easy to reach to all these isolated areas. But of course they are trying to gather all the efforts, articulations among the different ministries and actors involved in order to give enough support. The case of Paraguay is really critical because dengue is present very focused on this country, and now they have not so huge numbers of coronavirus, but it's increasing, and there is a big problem of lack of water. Thanks.
Thanks a lot, Cesarina. It's really helpful. I think Sarah has asked a question. Sarah, do you want to verbalize that? And maybe welcoming other colleagues to share any good examples that they might have heard of in terms of garbage handling at home or disposal of hospital waste. Any resources that you may have come across that we're unaware of. Welcome, Sarah.
Before giving the floor to Sarah, I would like to specify that all solid waste and health facility waste was not part of the scope of the measures at this stage of the research. Of course, we can include that at a later stage. So there are not specific, we have not searched for specific resources on the matter.
But yeah, thank you, Virginia. But what we can also say is that basically what is being asked for the WASH sector in terms of prioritizing the WASH sector for protective equipment for the staff, for ensuring provision of the key products and consumables for the operators, and so on. The same applies at the end of the day for the electricity services, for the waste services, for all the basic services. So I think it might not be necessarily we still have to discuss with CIWI if we want to make specific recommendations, but I guess these recommendations for the waste sector will be the same that are already flagged in the document for the WASH sector per se. Maybe just a final comment regarding this matrix and especially for your comments. If you really want to have your country being flagged and being well represented in this mapping, in this regional mapping, please send us through the Excel sheet. I mean, it's a shared file. The links to the information where CIWI should be looking at in order to get the information about this WASH public policies that are being taken or not during this COVID response. So if you provide them with this source of information, they will do then the nitty-gritty details of investigating and then we will be able to have probably like a specific Caribbean mapping of what's happening in the WASH sector. Thank you.
Hi, Justin, for you, I will going to share with you on the chat 2 links in Spanish and English in order to share some information about water and sanitation, included waste solid. This is an information that we adapted from the WHO guideline, and it's important to know about that. Thank you.
Thanks a lot, Henry. I see that Valerie proposed that some of the operators could be presenting about their actions on COVID. Yeah, that would be much welcome. The next call we have, which will be on Tuesday at 11 a.m. in Spanish, will cover, as I mentioned, number 1, the Colombian government's measures on public policies and services for WASH. That will be presented by the Colombian Ministry of Water. There will also be a presentation from the WOP, the group of operators from Latin America and the Caribbean. So the Secretariat will be presenting about the group, but also about the resources available in the network that it exists. So it's a potential very good collaboration, Valerie, with Valeria, actually her name, from the WOP group. And there will also be a presentation on the Ecuador COVID response plan, so that other coordination platforms that are working on it can gain from it, or can even consider revising some of the aspects of their own. so to foment exchange. And yeah, I think on another meeting we've been discussing on gender issues related to WASH and COVID, and more practical presentations from operators would be welcome. I think it's 12:10. We still have 20 minutes. I would like to get to the action points and to a round of introductions. So I will take Inez's point and maybe one or two more points, and then we can move to the last bit of the meeting. So Inez is asking if anyone is working in improving access to water in schools in MSC affected rural area in the Caribbean. If so, please contact FAO. FAO is looking at strengthening the water component in the school feeding programs. I think UNICEF, just to add to what Inez is saying, I think UNICEF is also working with the education and WASH colleagues on essential basic, WASH services in schools that are still offering feeding programs. So yeah, please keep us looped in as well. I think would be great. Inez, do you want to comment, or you're happy to keep it that way? Henry shared a webinar link. Henry, do you want to comment on that?
No. I'm writing a link about a webinar that we're going to have this afternoon. It's in Spanish, but it's about the solid waste, management solid waste.
Great, thank you, Henry. So I don't know if you have a plan to have it in English, like our meeting next week that I was mentioning about in Spanish. We will have the English version of it until we can get live translation. So Henry, do you, for this specific solid waste meeting from this afternoon, do you plan to have an English version for the colleagues who may be interested and don't speak Spanish, or not yet?
Not yet, but we are going to talk with them, with I don't know how to say, PENUMA, UNEP, in order to have this webinar for the Caribbean and the English countries.
Fantastic. Okay, that's great. Any other points? If Henry, at qué hora is the webinar? Henry, could you please provide some details of the webinar on the chat box, like the time? I guess the link is already there, and the time zone as well.
The time is 2 p.m. Panama time.
Okay, 2 p.m. Panama. So I will get to the action points so that we can have a little bit of time to introduce ourselves and keep to the time. So sharing my presentation, I try to compile some of the action points discussed. If I have missed anything, please feel free to add on the chat box. Sorry, the presentation is loading, but just let me start mentioning so that we don't waste too much time. So the first thing is to please update your contact details on our contact list. For the regional colleagues that are working in a regional type of position, you can indicate what language preference you have on the contact list sheet. There is a column about that, so that you can avoid duplication of emails. So if you want to just receive the English or just the Spanish ones, we can do that to avoid too many email influx. We would try to keep the information the same, or as much as possible similar, except for when there are context specific points. And then if you didn't receive this invitation from me, from Sunny Guidotti, then you can please add yourself to the link that Alban shared on the chat box, because you're not on the list. So we want to make sure we reach you. Another action point that we discussed in this meeting was that Lynn from COLP will be sharing a link to a webinar they will do, I think on markets and cash and WASH. And there is an English, French, and Spanish version. So Lynn, we're really very much welcoming that. I will be sharing the slides as requested on the next weekly update. Highlighting again that if you're interested to be part of the Rural Vulnerable Working Group under this, our sector group, led by Daniel Oporto, please let us know, or Danielle directly. We have shared his details in the last weekly update, and we will do it again this time. I think there wasn't any strong opinions around the joint meeting, so we will look into potential live translation so that we can have a joint sort of Spanish, English, French meeting. And I know that is possible because some other fora is doing, like the Sanitation and Water for All meetings took place in this way. So we will try our best to see if that's possible for us. I've shared the link to our Google site where all the available resources are, and we are trying to update it regularly, and we are hoping to get an IM person to support us a bit more. But in the meantime, please do visit and find all the reports and resources and the latest information there. We have shared with this invitation this morning the English UNICEF COE report. There will be a French version, and all of that is also on our website, but we will make sure to include the links on the weekly update. And please do reach out to Henry, to Alban, and to myself at any time if you need support. We're trying to foment an exchange between different coordination platforms in different countries, and we're here to support you in anything related to the coordination of the sector or the advancement of the response to COVID. And if you have any specific ideas or requests for the next meeting, please do share those in the chat box. Without further ado, I will move to the introductions. A little bit of a strange order, but given we have a few more minutes, maybe we can go by alphabetic order. So I think Alban already introduced himself, so the next will be Antonio, and then so and then so on. Maybe
sorry, Sonny,
yeah.
Sonny, may I just jump in? Sorry, just 2 seconds before we move to the presentations. Just to add, I mean, for us, I mean, at the regional group, WASH-LAC group, it's fundamental that we get in touch with who are the coordinators of the national WASH in emergency platforms. So if you are one of these co-leader or co-leader at national level, or if you know about co-leaders in other countries in the Caribbean, please send us their contact details. We really want to have like direct communication with them. And also, if you also have like a close contact with CAWASA, the Caribbean Water and Sewerage Association, or CWWA, Caribbean Water and Wastewater Association, and the Caribbean Disaster Emergency Management Agency, regarding specifically who would be the focal point for WASH, for water and sanitation, please provide us with these details. And also, just one or two other things. I mean, the document that has been produced by COE is very good for advocacy, but it's also very good for you if you don't have a response plan at national level, to use it as a basis, also including obviously what the WHO is recommending as a response plan. And finally, I think it's super fundamental that we make all efforts to make sure that the frontline workers in the WASH sector, but also in health, are really informed about like the key protection and prevention and control of infection messages. So how do you do this? I mean, it would be very interesting to know in your countries how you manage to get like a vast impact, reaching out to all the health agents, all the WASH people working in the WASH sector. Thank you, Sonny.
Thank you, Alban. And I think just a follow-up is that as we get the COVID plans from the different countries, we will try to put that on our site so that that's available for different colleagues to exchange on. And if you do have questions or need of support, do reach out so we can try and link you up with other tables that are on the same process or that are a bit more advanced. So I just wanted to ask that the presenters present themselves in alphabetic order, and then the attendees at alphabetic order, so that we know who is around the table, and make it a little bit more personable, given it's a virtual world these days. So Antonio, Andres, if you don't mind starting.
Hello, everyone. Thanks, Annie. This is Antonio Andres, working with UNICEF in Guatemala right now. But as I was working in East Caribbean area before, I'm giving some support to LAC office, to Panama office. Thanks.
Ian, you can go ahead.
Hello, good afternoon. This is Ian Jones. I'm the emergency officer with UNICEF for Guyana and Suriname, based in Guyana. I'm working with Patrick, who will introduce himself in a little while, supporting with the WASH in Suriname. Over.
Thank you. I think you say it, Ian. I'm Patrick Matala. I'm the program manager in Suriname. And also I'm one of the key fan of the WASH in region. Yes, so I'm also COVID-19 focal point here in Suriname. Thank you.
Hello, good day. My name is Mignon Rochenford. I am the coordinator of health promotion in Dominica, and also coordinating of WASH. And we were happy to work with Antonio earlier on from WASH, Panama. Thank you, Dominica.
Hello, I don't know if we're still going in order. I'm Isabel Alvarez. I'm working as a program officer for CIWI based in Stockholm. I'm originally from Ecuador. Over.
Hello, it's Cristina Meza Reyes. I'm working as water and sanitation specialist from IDB, Inter-American Development Bank in Bolivia. Greetings for all, and thanks for the presentation.
We can have Joseph Beneche, or Beneke, I don't know.
Hi everyone, I am Joseph Benesh from Haiti. I work as WASH officer. I'm now supporting the emergency unit.
Thank you, Joseph. Lene Alexandra, and then Sarah.
Yes, hello, this is Alexandra Blason. I'm the chef of WASH in Haiti. Over.
Sarah Menendez. Okay, maybe we can move to the attendees. Maybe Sarah has an issue with her mic. Anyone from the attendees list who would like to introduce themselves?
I'm the last, I think, from the presenters. My name is Virginia Maria Escurrena. I am a program manager at CIWI, and I am responsible of the collaboration between CIWI and UNICEF for the regional collaboration agreement with Latin America, and I am originally from Argentina. Over.
Sorry, Suni, I'm here. Sara Menendez from Dominican Republic. I am the Child Survival and Development Officer. I'm focal point for WASH in Dominican Republic.
Great, thank you, Sarah. Maybe moving out to the attendees, we have Alka Human Guzman, I think, and then Aurora. Please go ahead on the order.
Hello, everybody. My name is Rosa Maria Alquebaman for Swiss Development Cooperation based in Lima, Peru. Unfortunately, I joined a little bit later, but thank you so much for this interesting presentation.
Thank you. Aurora Egea.
Hello, I am Aurora Ege. I am the WASH coordinator for ACH in Venezuela. Yeah, thank you for the presentation.
Barasa, I think it's Barasa, Lorenzo, and Ines.
Hi, this is Ines Bernat. I am Land and Water Officer at the Air Force Regional Office for Mesoamerica. In terms of COVID, I am actually working at regional level, and that's the reason I also attended this webinar today. Having started my career on water with UNICEF, I have to say WASH is in my heart, and I'm trying my best to really strengthen the WASH in our program, especially in terms of access to water, sanitation, hygiene in schools, especially in rural areas. And that's the reason that I made this comment previously, and I'm looking forward to work with anyone who is already working in that field. Thank you. Both for Caribbean and Latin America. Thank you.
And I would like to present to Lorenzo. Lorenzo Barraza is a colleague from PAHO office in Panama. He's part of the sub-regional group for emergency for Central America. Over.
Thank you. I think, let's see who's next. Bernard Etinov, Cristina Meserres, David Sanchez.
Yes, well, good afternoon all. It's a pleasure to be part of this meeting here today. The General Manager of the Dominica Water and Sewage Company Limited, and of course had the opportunity to work with the WASH group in Dominica following Hurricane Maria. Thank you.
Thank you.
Cristina Meterreyes from IDB Bolivia, Water and Sanitation Specialist. Thank you for the presentation.
Hello for all, I'm David Sanchez from Ecuador for emergency response. Thank you.
Thank you. We're getting halfway through the attendees, and we have 2 minutes. So we have Doeaxa, and Sally, and Natalia. Maybe Sally,
I don't know if Sally is there, but Sally is another colleague from PAHO based on Panama, regional advisor for environmental health and climate change. Over.
Thanks, Henry. Natalia, Henry, if you want to introduce yourself again, Jimena, please welcome to introduce yourselves.
Hi, I'm Jimena Peroni. I am cash and market specialist supporting the regional office and hosted by the Federation.
Thank you, Jimena. Henry, do you want to introduce yourself again, or should we move on to Mignon? I think Mignon introduced herself.
Okay, again, Henry Hernandez from PAHO based on Peru. I am the regional advisor on public health environment of the regional technical team of water and sanitation. Thank you. Over.
Thank you. I think Mignon mentioned she's working in Dominica, but if you want to introduce yourself, Mignon, again. If not, then we move to Minerva Pinello. Minerva? Okay, if not, Pablo Rodriguez.
Hello, everyone. My name is Minerva Pinello, and I'm calling from Belize. I am presently supporting a partnership between UNICEF and the Ministry of Health. Thank you for this opportunity. Over.
Thank you, Minerva.
Hi, everybody. My name is Pablo Rodriguez from NRC. Thanks for the invitation. I'm the team leader and WASH and Shelter from NRC from Ecuador. Thank you. Over.
And we have Charmaine and Valerie, and then Wayne Williams.
Hey again, Charmaine Closwell, representing COFA, Caribbean Public Health Agency.
Thank you so much.
Valerie Jenkinson, Chair of Operators Without Borders, and also the focal point for Canada for Global Water Partners. Live in Canada, but live in the Caribbean half the year.
Okay, great. And Wayne Williams?
Hi, this is Wayne Williams. I'm the Executive Director of the CWA. That's the Caribbean Water and Wastewater Association. We're a non-governmental NGO, regional NGO. You can get, because we have no time left, you could go to cwwa.net and check us out. Actually, two of our members, Valerie and Bernadette, are on the call as well. So welcome. Thank you.
Thank you, Wayne. If you want to share with me bilaterally the link, we are happy to include that on the weekly update of the WASH sector group. With that, I will close the meeting if Henry and Alban agree. And I think we're only 2 minutes behind, so let's try to keep it to time. Henry, Alban, anything else to add?
No, thank you very much, Sunny. And maybe just, just to remember, if you didn't receive this email directly by Sunny, please just put your email in the chat box, and we'll contact you further. And thank you, Bernard, for your email. We had the official one, so now we've got all your emails. Thanks again. Thanks to everyone. Bye bye.
Nothing to add.
Okay, bye bye.
Bye bye. Bye bye.
Okay, thanks all. Bye bye.
Thank you so much to everyone. Have a good one.
Bye-bye.
Thank you, everybody. Have a good lunch.